Welcome back to MedSpirit. You're listening to Diabetes Beyond Sugar 2, the overlooked factors that influence blood sugar. This second book takes you deeper, shining a light on the hidden forces like stress, aging, hormones, and lifestyle that impact blood sugar beyond just food. This is your guide to seeing the full picture of diabetes management. So take a deep breath, open your mind, and let's explore together. Let's begin. Introduction. For years, diabetes has been widely misunderstood. Most people believe it is simply caused by eating too much sugar, but the reality is far more complex. While diet plays a role, diabetes is influenced by multiple factors, including sleep patterns, aging, stress, genetics, and even cultural habits. Yet discussions around diabetes often focus only on food and weight, overlooking these crucial elements that shape the way our bodies process blood sugar. This book takes a broader look at diabetes, one that goes beyond sugar and weight gain. It explains how sleep deprivation can disrupt insulin function, how aging changes the body's ability to regulate glucose, and how different cultures experience and manage diabetes in unique ways. By shifting the focus from a single cause to a holistic understanding, we can better prevent, manage, and treat diabetes in a way that aligns with real-life challenges. One of the most overlooked connections to diabetes is sleep. Studies show that poor sleep and irregular sleep schedules can increase the risk of insulin resistance, leading to higher blood sugar levels over time. People who work night shifts, experience chronic sleep deprivation, or have irregular sleep patterns are often at a greater risk of developing diabetes. Yet this factor is rarely discussed in mainstream health advice. Similarly, aging brings changes to metabolism, making it harder for the body to maintain stable blood sugar levels. As people grow older, insulin sensitivity tends to decrease, and other health conditions like high blood pressure and heart disease often appear alongside diabetes. Understanding how age influences diabetes risk can help in creating better prevention and management strategies tailored to different life stages. Another key perspective is how diabetes varies across the world. In some regions, traditional diets and active lifestyles have kept diabetes rates lower, while in others, modernization and processed foods have led to a surge in cases. By studying different cultural approaches to diet, movement, and healthcare, we can learn valuable lessons that can improve diabetes prevention and treatment. Diabetes is not just about blood sugar, it's about how the entire body functions. The goal of this book is to uncover these deeper connections, providing a more complete picture of what really influences diabetes. Whether you are managing diabetes yourself, at risk, or simply curious about how sleep, aging, and lifestyle affect health, this book will give you insights backed by science and real-world examples. It's time to move beyond outdated ideas and embrace a more comprehensive understanding of diabetes, one that considers the body as a whole rather than just the food on our plates. Chapter 1. Diabetes and Sleep. Sleep is that golden chain that ties health and our bodies together. Thomas Dekker. For many people, sleep and diabetes seem like unrelated topics. Most discussions about diabetes focus on food, exercise, and medications, but few highlight the critical role that sleep plays in blood sugar regulation. However, research has consistently shown that poor sleep can increase the risk of insulin resistance, raise blood sugar levels, and even contribute to the development of type 2 diabetes. Sleep is not just a time for rest, it is an active period where the body carries out essential maintenance. During deep sleep, the body repairs tissues, balances hormones, and regulates metabolism. When sleep is disrupted, whether due to short sleep duration, irregular sleep schedules, or sleep disorders like sleep apnea, it can throw the body's metabolic system out of balance, making it harder to control blood sugar. One of the key ways sleep impacts diabetes is through insulin sensitivity. Insulin is the hormone responsible for helping cells absorb glucose from the bloodstream. When people don't get enough sleep, their body's ability to respond to insulin decreases. In fact, studies have found that just one night of poor sleep can lead to higher blood sugar levels the next day, even in people who don't have diabetes. Over time, chronic sleep deprivation can lead to insulin resistance, a condition where the body needs more insulin to keep blood sugar levels stable, increasing the risk of diabetes. Another major factor is the role of sleep in appetite regulation. Lack of sleep can lead to imbalances in hunger-related hormones, ghrelin, which increases appetite, and leptin, which signals fullness. When people don't get enough sleep, ghrelin levels rise, leading to increased cravings for sugary and high-carb foods. At the same time, leptin levels drop, making it harder to feel full. This combination often leads to overeating and weight gain, both of which contribute to diabetes risk. Beyond insulin and appetite, the body's natural circadian rhythm also plays a role in blood sugar control. The circadian rhythm is the body's internal clock, regulating sleep-wake cycles and metabolism. When people work night shifts, frequently travel across time zones, or have irregular sleep patterns, their circadian rhythm gets disrupted. Studies show that people who work late nights or irregular shifts have a higher risk of developing diabetes, even if they eat well and exercise. Sleep disorders like obstructive sleep apnea, OSA, are another overlooked cause of diabetes complications. Sleep apnea causes repeated pauses in breathing during sleep, reducing oxygen levels and triggering stress responses in the body. This leads to increased cortisol, the stress hormone, inflammation, and higher blood sugar levels. Many people with type 2 diabetes also have sleep apnea without realizing it, and treating the condition can significantly improve blood sugar control. The good news is that improving sleep habits can lead to better diabetes management and lower the risk of developing the disease. Simple changes like maintaining a regular sleep schedule, reducing screen time before bed, creating a relaxing bedtime routine, and addressing sleep disorders can all help support healthy blood sugar levels. In the next chapter, we will discuss how specific sleep patterns, such as shift work and chronic sleep deprivation, can directly contribute to diabetes risk, and what can be done to counteract these effects. Chapter 2. Shift work, sleep deprivation, and diabetes risk. The best bridge between despair and hope is a good night's sleep. E. Joseph Kosman. Modern life has forced many people into unnatural sleep schedules. Shift workers, healthcare professionals, truck drivers, factory workers, and many others often work through the night and sleep during the day. While this may seem like just an adjustment in routine, research shows that disrupting the body's natural sleep cycle can have serious effects on metabolism and significantly increase the risk of diabetes. The human body is designed to follow a natural 24-hour rhythm known as the circadian clock. This internal clock regulates sleep, metabolism, and hormone production. It dictates that we should be awake during daylight hours and asleep when it's dark. When people work night shifts or have erratic sleep schedules, this rhythm is disrupted, which can lead to insulin resistance, weight gain, and increased blood sugar levels over time. Numerous studies have linked shift work to a higher risk of type 2 diabetes. One large-scale study found that people who worked irregular shifts had a 44% higher risk of developing diabetes compared to those with stable daytime jobs. The reasons for this are clear. Shift workers often experience chronic sleep deprivation, eat at irregular hours, and are more likely to rely on processed or fast food due to their unusual schedules. These factors combined create an environment that makes it harder for the body to regulate blood sugar effectively. Sleep deprivation is another major factor in diabetes risk. When the body doesn't get enough rest, it triggers a stress response, releasing hormones like cortisol and adrenaline, which can lead to higher blood sugar levels. Sleep-deprived individuals also experience reduced insulin sensitivity, meaning their bodies have to produce more insulin to keep glucose levels stable. Over time, this overproduction of insulin can lead to pancreatic exhaustion, paving the way for type 2 diabetes. Additionally, poor sleep affects food choices. Studies show that when people are sleep-deprived, they are more likely to crave high-calorie, high-carb foods. This is because lack of sleep alters the balance of two key hunger hormones: ghrelin, which increases hunger, and leptin, which signals fullness. As a result, people who don't get enough sleep tend to eat more and gain weight, which further increases their risk of diabetes. The good news is that small changes can help reduce the impact of shift work and sleep deprivation on diabetes risk. For those who work night shifts, it's important to create a consistent sleep schedule, even on days off, to keep the body's internal clock as stable as possible. Using blackout curtains, limiting caffeine before bedtime, and wearing blue light blocking glasses before sleep can also help improve sleep quality. Another key strategy is timing meals properly. Eating large meals late at night can spike blood sugar levels, so shift workers should focus on eating balanced meals at regular intervals and avoiding heavy high-carb foods before bed. Engaging in regular physical activity, even short walks after meals, can also help keep blood sugar stable. While shift work and sleep deprivation are unavoidable for some, being aware of their impact on blood sugar and metabolism is the first step in making healthier choices. By improving sleep quality, managing stress, and maintaining a balanced diet, it is possible to reduce the risk of diabetes, even with a non-traditional schedule. In the next chapter, we will explain how circadian rhythms and metabolism are deeply connected, and why keeping a stable body clock can make all the difference in diabetes prevention and management. Chapter 3: Circadian Rhythms and Blood Sugar Control. The rhythm of the body, the melody of the mind, and the harmony of the soul create the symphony of life. BKS Iyengar. The human body operates on a natural internal clock known as the circadian rhythm, which regulates sleep, hormone production, digestion, and metabolism. This rhythm follows a 24-hour cycle and is heavily influenced by external factors like light exposure, meal timing, and sleep patterns. When this rhythm is disrupted, whether due to shift work, irregular sleep schedules, late-night eating, or excessive screen time before bed, the body's ability to regulate blood sugar is significantly affected. At the core of this process is the relationship between the circadian rhythm and insulin sensitivity. In a well-functioning system, insulin sensitivity is highest in the morning and gradually decreases throughout the day, meaning the body processes carbohydrates more efficiently earlier in the day. However, when sleep schedules are irregular or meal timing is inconsistent, this natural rhythm is thrown off balance, leading to elevated blood sugar levels and increased risk of insulin resistance. One of the most concerning effects of circadian disruption is its impact on nighttime blood sugar levels. Research shows that people who stay awake late at night or eat heavy meals before bed often experience higher fasting blood sugar levels in the morning. This is because the body's metabolism slows down at night, making it harder to process glucose efficiently. Over time, this can contribute to prediabetes and type 2 diabetes. Another key player in the circadian metabolism connection is the hormone cortisol, commonly known as the stress hormone. Cortisol follows a daily cycle, with levels typically peaking in the morning to help wake the body up and then gradually decreasing throughout the day. However, poor sleep and irregular schedules can cause cortisol levels to remain elevated at night, leading to higher blood sugar levels and increased fat storage, both of which contribute to diabetes risk. Interestingly, studies have also found that exposure to artificial light at night, especially blue light from screens, can further disrupt circadian rhythms and glucose metabolism. Blue light exposure suppresses the production of melatonin, the hormone that signals the body to sleep. This not only makes it harder to fall asleep, but also disrupts the natural balance of metabolic hormones, increasing the risk of blood sugar imbalances. So what can be done to align circadian rhythms with better blood sugar control? The most effective strategy is to maintain a consistent daily schedule, even on weekends or days off. Going to bed and waking up at the same time each day helps stabilize the circadian clock, improving insulin sensitivity and overall metabolic health. Additionally, meal timing plays a critical role. Research suggests that eating the majority of daily calories earlier in the day, rather than late at night, can improve blood sugar regulation and reduce diabetes risk. This concept, often referred to as circadian fasting or time-restricted eating, aligns food intake with the body's natural metabolic rhythms. Exposure to natural light is another key factor. Spending at least 30 minutes in sunlight during the morning helps reinforce the body's natural circadian rhythm, improving both sleep quality and metabolic function. At night, reducing screen exposure at least an hour before bed and using warm, dim lighting can help the body naturally wind down. By understanding and respecting the body's circadian rhythms, it becomes possible to optimize blood sugar control, reduce insulin resistance, and lower the risk of diabetes. Rather than fighting against our biological clocks, we can work with them to promote long-term health and metabolic balance. In the next chapter, we will explain how aging affects diabetes risk, the why insulin sensitivity declines over time, and what steps can be taken to maintain blood sugar balance as we grow older. Chapter 4. Aging and Diabetes, Why Risk Increases Over Time. Do not regret growing older. It is a privilege denied to many. Unknown to Mark Twain. Aging is an inevitable part of life, bringing with it changes in metabolism, hormone levels, and overall health. One of the most significant concerns associated with aging is the increased risk of type 2 diabetes. Research shows that older adults are more likely to develop insulin resistance, experience higher blood sugar levels, and face greater challenges in managing diabetes compared to younger individuals. But why does this happen, and what can be done to slow down the process? One of the primary reasons diabetes risk increases with age is a decline in insulin sensitivity. As people grow older, their cells become less responsive to insulin, meaning that more insulin is required to process the same amount of glucose. Over time, the pancreas struggles to keep up with this demand, leading to rising blood sugar levels and eventually diabetes. Another factor is the loss of muscle mass. Muscle plays a crucial role in blood sugar regulation, as it is one of the primary sites where glucose is stored and used for energy. However, as people age, muscle mass naturally declines, a process known as sarcopenia. This loss of muscle reduces the body's ability to absorb and use glucose efficiently, contributing to higher blood sugar levels and an increased risk of insulin resistance. Additionally, aging is associated with changes in fat distribution. While younger individuals tend to store fat evenly throughout the body, older adults often experience an increase in visceral fat, the deep fat stored around organs like the liver and pancreas. Visceral fat is specifically dangerous because it releases inflammatory substances that interfere with insulin function, further promoting insulin resistance and diabetes development. Hormonal changes also play a role. As people age, there is a gradual decline in hormones that regulate metabolism, including growth hormone, testosterone in men, and estrogen in women after menopause. These changes can slow down the body's ability to process carbohydrates efficiently, making it easier for blood sugar levels to rise. Postmenopausal women, in particular, are at a higher risk of developing type 2 diabetes due to the decline in estrogen, which plays a protective role in glucose metabolism. Beyond biological changes, lifestyle factors also contribute to diabetes risk in older adults. Many people become less physically active as they age, leading to reduced calorie expenditure and increased weight gain. Poor sleep quality, chronic stress, and long-term exposure to unhealthy diets further contribute to the problem. The good news is that aging does not have to mean an inevitable progression to diabetes. There are several strategies that can help maintain insulin sensitivity and blood sugar control well into old age. Strength training and physical activity. Since muscle plays a key role in glucose metabolism, engaging in regular resistance training can help preserve muscle mass, improve insulin sensitivity, and lower diabetes risk. Even light exercises, such as walking or yoga, can make a significant difference. Balanced diet with fiber and protein. A diet rich in whole foods, fiber, lean protein, and healthy fats can help prevent blood sugar spikes. Avoiding processed carbohydrates and sugary foods can slow down the onset of insulin resistance. Maintaining a healthy weight. Reducing visceral fat through a combination of exercise and proper nutrition can help keep blood sugar levels in check. Managing stress and sleep quality. Since chronic stress and poor sleep contribute to high blood sugar levels, practicing relaxation techniques, maintaining a regular sleep schedule, and improving sleep hygiene can support metabolic health. Regular checkups. Since diabetes risk increases with age, it's important to monitor blood sugar levels, cholesterol, and blood pressure regularly to catch any signs of insulin resistance early. Aging may be inevitable, but diabetes does not have to be. By making simple but effective lifestyle adjustments, it is possible to maintain healthy blood sugar levels and prevent the complications associated with diabetes as we grow older. In the next chapter, we will explain how different countries and cultures approach diabetes prevention and management, and what lessons we can learn from global perspectives on diabetes care. Chapter 5: Global Perspectives on Diabetes, Lessons from Around the World. The greatest wealth is health. Virgil diabetes is a global epidemic, affecting millions of people across different countries, cultures, and lifestyles. While the disease itself is the same, its causes, prevention, and management vary greatly from one region to another. Some countries have higher diabetes rates due to diet and lifestyle habits, while others have successfully reduced their diabetes burden through public health initiatives and traditional approaches. By looking at diabetes through a global lens, we can uncover valuable lessons about what works and what doesn't when it comes to preventing and managing this chronic condition. One of the most striking examples comes from Japan, where diabetes rates remain relatively low despite an aging population. Traditional Japanese diets, which are high in fish, vegetables, fermented foods, and green tea, contribute to better blood sugar regulation and overall metabolic health. Unlike Western diets, which are often high in processed sugars and unhealthy fats, the Japanese way of eating emphasizes portion control, mindful eating, and a balance of macronutrients. Additionally, Japan has a strong culture of daily walking and movement, which helps maintain insulin sensitivity and prevent obesity. In contrast, India has one of the highest rates of diabetes in the world, despite a historically plant-based diet. This is due in part to the rise of processed foods, increased sugar consumption, and sedentary lifestyles in urban areas. Traditional Indian meals are often rich in whole grains, lentils, and spices like turmeric, which have been shown to have anti-inflammatory and blood sugar regulating properties. However, modern dietary shifts, such as the increased consumption of white rice, deep-fried snacks, and sugary beverages, have contributed to a rise in type 2 diabetes. This highlights the importance of not just what people eat, but also how food culture evolves with modernization. Meanwhile, Scandinavian countries like Sweden and Finland have taken a proactive approach to diabetes prevention through strong public health policies. Governments promote active lifestyles, nutritious school lunches, and public awareness campaigns about the dangers of sugar and processed foods. Research from these regions also suggests that regular consumption of dairy products like yogurt and cheese, along with fiber-rich foods like rye bread and berries, may help lower diabetes risk. These countries show how a combination of government intervention, education, and dietary traditions can help control diabetes rates. Another country worth noting is Mexico, where diabetes is a major public health concern. The high consumption of processed foods, sugary sodas, and refined carbohydrates has led to an explosion of type 2 diabetes cases. In response, the Mexican government introduced a sugar tax in 2014 to reduce soda consumption, and while the impact has been positive, changing deep-rooted dietary habits remains a challenge. This serves as a reminder that policy changes alone are not enough. Cultural shifts in food and lifestyle are also necessary for long-term diabetes prevention. Africa presents a different challenge, as many parts of the continent are experiencing a double burden of malnutrition and diabetes. While some regions still struggle with undernutrition, urbanization has led to an increase in fast food consumption, physical inactivity, and obesity-related diabetes. Traditional African diets, which once focused on whole grains, vegetables, and lean proteins, are now being replaced by processed foods high in sugar and unhealthy fats. Some countries, like South Africa, have launched health campaigns to encourage better eating habits and more physical activity. But the challenge remains significant. Looking at these global examples, it's clear that diabetes is influenced by a combination of genetics, diet, lifestyle, and societal changes. Some key takeaways from different parts of the world include a return to whole, unprocessed foods, as seen in Japan and Scandinavia, can help maintain stable blood sugar levels. Portion control and mindful eating play a crucial role in preventing overconsumption and obesity-related diabetes. Physical activity, whether through walking, cycling, or active daily routines, significantly improves insulin sensitivity. Public health policies, such as sugar taxes and nutrition education, can help reduce diabetes rates, but they must be accompanied by cultural changes. Modernization and urbanization often lead to increased diabetes risk, making it essential to preserve the healthy aspects of traditional diets. By understanding how different countries and cultures approach diabetes prevention, we can apply the best strategies to our own lives. Diabetes is not just an individual problem. It is a global issue that requires both personal and societal action. In the next chapter, we will explain the connection between stress, mental health, and diabetes, how emotional well-being plays a crucial role in blood sugar regulation, and what can be done to manage stress effectively. Chapter 6. Stress, Mental Health and Diabetes, the Hidden Connection. It is not stress that kills us, it is our reaction to it. Hans Selye. Diabetes is often seen as a condition linked to diet and exercise, but one of the most overlooked factors influencing blood sugar levels is stress. In today's fast-paced world, chronic stress has become a common issue, and its impact on metabolism, hormone regulation, and insulin sensitivity is significant. When stress goes unmanaged, it can contribute to the onset, progression, and difficulty in controlling diabetes. At the core of this connection is the stress response system, which triggers the release of hormones like cortisol and adrenaline. These hormones prepare the body for a fight-or-flight reaction by increasing blood sugar levels to provide quick energy. In short bursts, this response is helpful, such as when facing danger or an immediate challenge. But when stress becomes chronic, blood sugar remains elevated for extended periods. Over time, this leads to insulin resistance, weight gain, and a higher risk of developing type 2 diabetes. Scientific studies have shown that people experiencing high levels of stress, whether due to work, financial struggles, family problems, or emotional trauma, are more likely to develop diabetes. This is partly because stress not only raises blood sugar levels, but also encourages unhealthy coping mechanisms, such as overeating, consuming sugary or processed foods, smoking, and lack of physical activity. Many people turn to comfort foods high in sugar and fat, which provide temporary relief but contribute to long-term metabolic problems. Another key link between stress and diabetes is poor sleep quality. Chronic stress disrupts the body's natural sleep cycle, leading to insomnia, restless nights, and sleep deprivation. Since sleep is essential for blood sugar regulation and insulin function, ongoing sleep disturbances further increase the risk of diabetes. In fact, research has found that people who sleep less than 6 hours per night have a significantly higher likelihood of developing insulin resistance. Mental health conditions such as anxiety and depression also play a major role in diabetes risk. Studies indicate that depressed individuals have a 60% higher risk of developing type 2 diabetes compared to those without depression. This is due to higher levels of inflammation, increased cortisol production, and poor lifestyle habits associated with mental health struggles. Moreover, for individuals already diagnosed with diabetes, managing the condition can become overwhelming, leading to diabetes distress, which makes self-care and glucose control even more difficult. The good news is that managing stress and mental health can significantly improve blood sugar regulation and reduce diabetes risk. Some effective strategies include mindfulness and meditation. Studies show that practicing mindfulness, deep breathing, and meditation can lower cortisol levels, reduce blood sugar spikes, and improve insulin sensitivity. Physical activity. Exercise is one of the best ways to counteract stress, as it releases endorphins, the body's natural mood boosters, and helps lower blood sugar levels. Even simple activities like walking, yoga, or stretching can be highly effective. Quality sleep. Developing good sleep habits, such as sticking to a regular sleep schedule, reducing screen time before bed, and creating a relaxing bedtime routine, can help restore normal blood sugar balance. Healthy diet choices. Instead of turning to high-sugar, high-fat comfort foods during stressful times, consuming whole foods rich in fiber, lean proteins, and healthy fats can help stabilize mood and blood sugar levels. Social support and therapy. Talking to friends, family, or a mental health professional can help relieve stress and anxiety. Studies show that people with strong support systems tend to have better blood sugar control and lower rates of diabetes-related complications. Stress is unavoidable, but how we handle it makes all the difference. By actively managing stress and prioritizing mental well-being, it is possible to reduce the risk of diabetes and improve overall health. Mental health is just as important as physical health, and finding balance in both areas can lead to better long-term outcomes. In the next chapter, we will examine the role of technology and digital health solutions in diabetes prevention and management, including the latest advancements in wearable devices, AI-driven health monitoring, and personalized diabetes care. Chapter 7. Technology and Diabetes: How Digital Health is Changing the Game. The art of medicine consists of amusing the patient while nature cures the disease. Voltaire diabetes management has come a long way from the days of relying solely on blood tests at a doctor's office. Technology has revolutionized how we monitor, prevent, and treat diabetes, making life easier for millions of people worldwide. From continuous glucose monitors, CGMs, and smart insulin pens to artificial intelligence-driven health apps, digital health innovations are changing the way diabetes is understood and controlled. One of the most significant advancements in diabetes care is the continuous glucose monitor, CGM. Unlike traditional finger prick tests, which provide a single blood sugar reading, CGMs allow for real-time glucose tracking throughout the day. These tiny wearable devices attach to the skin and continuously measure blood sugar levels, sending updates to a smartphone or smartwatch. CGMs help individuals see patterns in their glucose fluctuations, understand how food and exercise impact blood sugar, and make immediate adjustments to prevent spikes or crashes. Another breakthrough is the development of smart insulin pens and pumps, which offer precision in insulin delivery. These devices can calculate and administer the correct insulin dose based on blood sugar readings, meal intake, and activity levels, reducing the risk of human error. Some newer models even connect to CGMs, creating a hybrid closed-loop system, often referred to as an artificial pancreas. This system automatically adjusts insulin delivery based on glucose levels, making diabetes management less burdensome. Mobile apps and AI-powered digital health platforms are also transforming diabetes care. Smartphone apps can track food intake, monitor physical activity, analyze blood sugar data, and even predict future glucose trends. AI-driven algorithms can offer personalized health insights, helping users make better decisions about their lifestyle. Some apps even provide real-time coaching from certified diabetes educators, ensuring that people receive timely support when they need it. For those at risk of developing diabetes, wearable fitness trackers and smartwatches offer a powerful tool for prevention. Devices like the Apple Watch, Fitbit, and Whoop Band can monitor heart rate, activity levels, sleep patterns, and stress levels, all of which play a role in blood sugar regulation. Studies show that people who use these devices tend to be more physically active, sleep better, and maintain healthier habits, all of which lower the risk of diabetes. Telemedicine has also emerged as a game-changer for diabetes management. Virtual consultations with endocrinologists, dietitians, and diabetes specialists allow people to receive expert advice without the need for frequent in-person visits. This is particularly beneficial for individuals in remote areas or those with busy schedules who might otherwise struggle to keep up with their medical appointments. Despite the many benefits of digital health, there are still challenges to consider. Not everyone has access to advanced technology, and the cost of CGMs, insulin pumps, and AI-driven health services can be high. Additionally, data privacy concerns remain a significant issue, as many digital health platforms collect sensitive health information. Ensuring affordable, secure, and widely available technology will be key to making these innovations accessible to all. Technology has transformed diabetes care, making it more personalized, proactive, and data-driven than ever before. As advancements continue, the future of diabetes management looks even more promising, with predictive analytics, gene-based treatments, and even fully automated insulin delivery systems on the horizon. In the next chapter, we will explain how nutrition plays a crucial role in diabetes prevention and management, separating fact from fiction when it comes to food choices and blood sugar control. Chapter 8. The Role of Nutrition in Diabetes, Separating Fact from Fiction. Let food be thy medicine, and medicine be thy food. Hippocrates. One of the biggest misconceptions about diabetes is that it is simply caused by eating too much sugar. While diet plays a critical role, the truth is more complex than just avoiding sweets. The way food affects blood sugar depends on several factors, including the type of carbohydrates consumed, overall meal composition, and an individual's metabolism. Proper nutrition is not just about restriction, it's about making informed food choices that support stable blood sugar levels and overall health. The idea that people with diabetes must completely eliminate sugar is a myth. The real issue is how quickly carbohydrates are broken down into glucose and absorbed into the bloodstream. Refined carbohydrates, such as white bread, sugary drinks, pastries, and processed snacks, cause rapid spikes in blood sugar. On the other hand, whole carbohydrates like brown rice, quinoa, legumes, and vegetables provide fiber, slow down digestion, and help prevent blood sugar spikes. Protein and healthy fats also play an essential role in blood sugar management. Lean proteins, such as fish, chicken, eggs, and plant-based sources like beans and tofu, help stabilize blood sugar by slowing down digestion and promoting satiety. Healthy fats from sources like avocados, nuts, seeds, olive oil, and fatty fish improve insulin sensitivity and help regulate inflammation, which is crucial for people with diabetes. Another key factor is the glycemic index (GI), a ranking system that measures how quickly foods raise blood sugar levels. High GI foods, like white rice, white bread, and sugary cereals, cause rapid glucose spikes, while low GI foods, such as whole grains, lentils, and non-starchy vegetables, have a slower, more stable effect. However, GI isn't the only consideration. The overall combination of foods in a meal matters just as much. Pairing carbohydrates with fiber, protein, or healthy fats helps moderate blood sugar responses. Meal timing and portion control are also important. Eating large amounts of carbohydrates in one sitting can overwhelm the body's insulin response, leading to higher blood sugar levels. Instead, consuming balanced meals throughout the day with appropriate portion sizes helps maintain steady energy levels. Additionally, intermittent fasting and time-restricted eating have gained attention for their potential benefits in improving insulin sensitivity and reducing diabetes risk. Beverage choices are another area that significantly impacts blood sugar. Sugary drinks, including soda, fruit juices, and energy drinks, are among the worst culprits for diabetes risk, as they provide large amounts of sugar without fiber to slow absorption. In contrast, water, herbal teas, and unsweetened drinks are better options. Even coffee and green tea have shown benefits in improving metabolism and insulin function, as long as they are consumed without added sugars or high-fat creamers. One of the most exciting areas of nutrition research focuses on the role of gut health in diabetes. The gut microbiome, the collection of bacteria in our digestive system, plays a significant role in metabolism, inflammation, and insulin resistance. Eating a diet rich in prebiotics, found in fiber-rich foods, and probiotics, found in fermented foods like yogurt, kefir, kimchi, and sauerkraut, can improve gut health and potentially lower diabetes risk. The challenge with nutrition is not just knowing what to eat, but also overcoming misinformation. Many so-called health foods marketed to people with diabetes, such as sugar-free snacks and artificial sweeteners, can still negatively affect metabolism and gut health. Additionally, extreme diets, whether low-carb, keto, or plant-based, may not be suitable for everyone. The best diet is one that is balanced, sustainable, and tailored to an individual's health needs and preferences. Ultimately, diabetes management is not about deprivation. It's about making smarter food choices that nourish the body while keeping blood sugar levels stable. By prioritizing whole, nutrient-dense foods, managing portions, and staying mindful of how different foods impact metabolism, people can take control of their health and reduce their risk of diabetes-related complications. In the next chapter, we will discuss how cultural and genetic factors influence diabetes risk, and why certain populations are more susceptible to the condition than others. Chapter 9. Genetics, Culture, and Diabetes. Why some populations are more at risk. Genes load the gun, but lifestyle pulls the trigger. Dr. Mehmet Oz. Diabetes is often thought of as a disease of lifestyle choices, but genetics and cultural factors also play a significant role in determining who is more likely to develop the condition. While diet and exercise are important, some people are simply born with a higher risk due to their genetic makeup. At the same time, cultural habits and traditions shape dietary patterns. Physical activity levels and access to healthcare further influencing diabetes risk. Understanding these factors is crucial to addressing why some populations are more affected than others. The genetic link to diabetes genetics do not directly cause type 2 diabetes, but they can increase susceptibility. If you have a parent or sibling with diabetes, your risk of developing it is significantly higher. Studies show that individuals with a strong family history of diabetes are up to 3 times more likely to develop the disease, even if they follow a healthy lifestyle. Research has identified several genetic variations that contribute to diabetes risk. These genes affect how the body produces and uses insulin, as well as how fat is stored and metabolized. Some genetic factors make individuals more prone to insulin resistance, while others impact pancreatic beta cell function, which is responsible for insulin secretion. However, genes alone are not destiny. Lifestyle choices and environmental factors still play a major role in whether or not someone with a genetic predisposition actually develops diabetes. This is why two people with the same genetic risk can have completely different health outcomes, depending on their diet, activity level, stress, and overall lifestyle. Ethnicity and diabetes risk. Some ethnic groups are disproportionately affected by diabetes due to a combination of genetics, diet, and historical lifestyle changes. Studies show that people of African, Hispanic, Asian, and indigenous descent have a significantly higher risk of developing type 2 diabetes compared to individuals of European descent. African and African American populations tend to have higher rates of insulin resistance and lower insulin secretion, putting them at greater risk. Traditional diets rich in whole grains, vegetables, and lean proteins have often been replaced with processed foods and high-sugar diets, further increasing diabetes risk. Hispanic and Latino populations have a higher prevalence of diabetes, partly due to genetic factors that impact glucose metabolism. Diets high in refined carbohydrates, such as white rice and tortillas, and lower physical activity levels have also contributed to rising diabetes rates. Asian populations, particularly South Asians, are at higher risk even at lower body weights compared to other ethnic groups. Many Asians develop diabetes at a normal BMI, suggesting that body fat distribution and genetic factors play a role. Indigenous and Native American populations have some of the highest diabetes rates in the world. A shift from traditional, high-fiber diets to processed foods has led to increasing cases of obesity and diabetes. Limited access to healthcare and economic disparities further contribute to poor diabetes outcomes in these communities. The impact of cultural habits and traditions. Culture shapes what we eat, how we move, and how we think about health, all of which influence diabetes risk. Many traditional diets were once rich in whole, unprocessed foods, but globalization, urbanization, and convenience foods have drastically altered eating habits. In many cultures, rice, bread, and starchy foods are dietary staples, making it harder to manage carbohydrate intake. In some societies, high-fat, high-sugar foods are a sign of prosperity, leading to overconsumption. Social gatherings and celebrations often revolve around food, making it difficult to resist unhealthy eating habits. Physical activity levels vary widely among cultures, with some populations leading more sedentary lifestyles due to urbanization and modern work environments. In addition to diet, healthcare access and cultural attitudes toward medicine play a role in diabetes management. In some communities, seeking medical help is discouraged, leading to delayed diagnosis and complications. Others rely more on traditional medicine and natural remedies, which may or may not be effective for diabetes control. Breaking the cycle, addressing genetic and cultural risks. While genetics and cultural habits can increase the risk of diabetes, they do not make it inevitable. Education, awareness, and targeted prevention strategies can make a significant difference. Personalized nutrition plans can help individuals modify traditional diets in a way that maintains cultural identity while reducing diabetes risk. Community-based health initiatives that respect cultural values can encourage healthier habits, such as group exercise programs and culturally adapted meal plans. Early screening and genetic testing can help individuals at higher risk take preventive measures before diabetes develops. Improving access to healthcare, especially in underserved populations, can ensure that more people receive timely diagnosis and proper management. Diabetes is a global issue, but its impact varies based on genetics, ethnicity, and cultural factors. By understanding these influences, we can take steps to reduce risk, improve prevention efforts, and create healthcare solutions that are inclusive and effective for all populations. In the next chapter, we will examine how diabetes affects different age groups, from children and young adults to older populations, and why prevention strategies should be tailored to different life stages. Chapter 10. Diabetes, Across the Lifespan, How Age Influences Risk and Management. Age is an issue of mind over matter. If you don't mind, it doesn't matter. Mark Twain. Diabetes does not affect everyone in the same way, and age plays a crucial role in how the disease develops, progresses, and is managed. From young children diagnosed with type 1 diabetes to middle-aged adults developing type 2 diabetes and elderly individuals facing complications, the impact of diabetes varies across different life stages. Understanding how age influences diabetes, risk and management is essential for preventing and controlling the condition at every stage of life. Diabetes in children and adolescents. For many years, type 1 diabetes was considered the primary form of diabetes affecting children. However, due to rising obesity rates and changes in lifestyle, type 2 diabetes is becoming increasingly common among younger age groups. This shift is alarming because children who develop diabetes early face a lifetime of health complications if it is not well managed. Type 1 diabetes in children occurs when the immune system mistakenly attacks insulin-producing cells in the pancreas, leading to insulin deficiency. Children with type 1 diabetes require lifelong insulin therapy, careful monitoring of blood sugar, and lifestyle adjustments. Type 2 diabetes in children is mainly driven by poor diet, lack of physical activity, and obesity. Unlike type 1, type 2 diabetes in children can often be prevented or reversed through weight management, healthy eating, and exercise. One major challenge in children and adolescents with diabetes is compliance with treatment. Many young people struggle with dietary restrictions, insulin injections, and regular monitoring, leading to unstable blood sugar levels. Additionally, mental health concerns such as anxiety, depression, and social pressures can make diabetes management even more difficult. Diabetes in young and middle-aged adults. The 20s, 30s, and 40s are often considered peak years for career growth, starting families, and building lifestyles. However, this is also the time when many people develop type 2 diabetes due to unhealthy habits, stress, and lack of routine medical checkups. Sedentary jobs and fast food diets contribute to insulin resistance and obesity. Many young adults prioritize work over health, skipping meals, relying on processed foods, and getting little exercise. High stress levels from work and personal responsibilities can trigger hormonal imbalances that worsen insulin resistance and lead to weight gain. Sleep deprivation is a growing concern, especially among professionals and new parents. Poor sleep is directly linked to higher blood sugar levels and increased diabetes risk. For young and middle-aged adults with diabetes, early diagnosis and lifestyle changes are critical. Many people in this age group ignore symptoms such as frequent urination, fatigue, and blurred vision until the disease has progressed. Regular health screenings, adopting healthier eating habits, and incorporating exercise into daily routines can prevent or delay complications. Diabetes in older adults and the elderly. Diabetes is most commonly diagnosed in people over 45, and its prevalence increases with age. Older adults with diabetes often face more severe complications, including heart disease, kidney problems, nerve damage, and cognitive decline. Managing diabetes in the elderly is challenging due to other age-related health conditions, mobility issues, and medication interactions. Metabolism slows down with age, making it harder to control blood sugar levels. Many older adults take multiple medications, which can interact with diabetes treatments and affect glucose regulation. Cognitive decline, including dementia and Alzheimer's disease, is linked to diabetes. High blood sugar levels over time damage brain cells, increasing the risk of memory loss and confusion. Physical activity declines in older age, leading to muscle loss and insulin resistance. For elderly individuals, Diabetes management should focus on balancing medications, maintaining physical activity, and ensuring proper nutrition. Additionally, fall prevention, mental health support, and regular health checkups are essential for improving the quality of life for older adults with diabetes. The importance of age-specific diabetes prevention and management. Since diabetes affects people differently at various life stages, prevention and management strategies must be age-appropriate. For children and adolescents, education, support, and lifestyle changes are crucial. Schools, parents, and healthcare providers must work together to create environments that encourage healthy eating and physical activity. For young and middle-aged adults, workplace wellness programs, stress management, and better work-life balance can help reduce diabetes risk. For older adults, medication management, routine screenings, and social support are key to preventing complications and maintaining independence. Diabetes does not have a one-size-fits-all approach. By recognizing the unique challenges that different age groups face, we can develop better strategies for prevention, treatment, and long-term health. In the next chapter, we will take a closer look at global perspectives on diabetes, how different countries and healthcare systems are tackling the disease, and what we can learn from their approaches. Chapter 11. A Global Perspective on Diabetes. How different countries are fighting the epidemic. Health is a universal human right, not a privilege for the few. Dr. Tedros Adhanom Ghebreyesus, World Health Organization Director General. Diabetes is a global health crisis, affecting more than 500 million people worldwide, and the numbers continue to rise. While genetics, lifestyle, and socio-economic factors play a role in its prevalence, how different countries approach diabetes, prevention and management varies greatly. Some nations have robust healthcare systems and effective policies, while others struggle with limited resources and rising diabetes-related deaths. Looking at diabetes from a global perspective allows us to identify successful strategies, learn from different healthcare systems, and implement best practices worldwide. In this chapter, we will discuss how various countries are tackling diabetes and what lessons can be applied globally. Diabetes in developed countries, strong healthcare, high costs. Wealthy nations, such as the United States, Canada, the United Kingdom, and Australia, have advanced medical technology, diabetes education programs, and access to medication, yet they also have some of the highest rates of type 2 diabetes. In the United States, nearly 1 in 10 people has diabetes. The country has access to cutting-edge research, insulin pumps, and continuous glucose monitoring, CGM devices, but high healthcare costs and limited insurance coverage make treatment inaccessible for many. Insulin prices in the US are among the highest in the world, leading some patients to ration their medication, which can be life-threatening. The United Kingdom offers free diabetes treatment through the National Health Service, NHS, making medication and checkups accessible. However, rising obesity rates and a high sugar diet contribute to increasing cases of type 2 diabetes. The UK government has responded by implementing sugar taxes on soft drinks and national weight loss programs. Canada and Australia also provide government-funded healthcare, making diabetes treatment more affordable. Both countries have strong awareness campaigns encouraging early diagnosis and healthy living. However, indigenous populations in these nations face significantly higher diabetes rates due to genetic susceptibility, historical trauma, and limited access to healthcare. Diabetes in developing countries, limited resources, rising cases. Low- and middle-income countries face a dual burden, an increase in diabetes cases but limited resources to manage the disease. Many developing nations are experiencing rapid urbanization, a shift to processed foods, and a decline in physical activity, leading to rising obesity and diabetes rates. In India, diabetes is often called a silent epidemic. The country has over 77 million diabetics, with millions more undiagnosed. Urbanization has led to less physical activity and more high-carb diets, increasing type 2 diabetes cases even in young people. While diabetes medications are relatively affordable, rural areas have little access to proper health care. China has the largest diabetes population in the world, with 140 million diabetics. The country's economic growth has led to lifestyle changes, such as more fast food, sugary beverages, and sedentary office jobs, fueling the diabetes crisis. The Chinese government has implemented screening programs, public health campaigns, and traditional medicine approaches to manage diabetes. In Africa, diabetes is often underdiagnosed. Many people cannot afford insulin or glucose monitors, leading to high rates of complications such as kidney failure, blindness, and amputations. Some countries like South Africa are expanding diabetes screening programs and increasing awareness, but challenges remain. Lessons from countries with low diabetes rates. Some countries have managed to keep diabetes rates low through strong healthcare policies, cultural habits, and active lifestyles. Japan and South Korea have some of the lowest obesity and diabetes rates. Their traditional diets, rich in fish, vegetables, and fermented foods, help regulate blood sugar levels. Additionally, walking and cycling are common forms of transportation, reducing sedentary behavior. In Scandinavian countries, Sweden, Norway, Denmark, public health programs focus on healthy school lunches, regular physical activity, and low sugar consumption. These nations also have universal healthcare, ensuring diabetes patients receive proper treatment. In Mediterranean countries, such as Italy and Greece, the diet is based on whole grains, healthy fats, olive oil, nuts, and lean proteins, reducing diabetes risk. Studies show that the Mediterranean diet is one of the best for diabetes prevention and management. Global strategies to fight diabetes. While each country faces unique challenges, some global strategies have shown promising results. Sugar taxes. Countries like the UK, Mexico, and South Africa have implemented taxes on sugary drinks to discourage excessive sugar consumption. This has led to a decline in soda sales and reduced sugar intake. Early screening programs. In countries like Finland and Singapore, nationwide diabetes screening helps detect high-risk individuals before they develop full-blown diabetes. Health education campaigns. Governments worldwide are launching awareness programs in schools, workplaces, and communities to teach people about healthy eating, physical activity, and diabetes prevention. Affordable medication initiatives. The World Health Organization, WHO, and non-profit organizations are working to make insulin and diabetes medications more affordable in low-income countries, ensuring that life-saving treatments are accessible to all. A global approach to a global problem. Diabetes is no longer a disease that affects only a few countries. It is a worldwide epidemic. While wealthier nations struggle with overconsumption and sedentary lifestyles, developing countries face economic barriers and healthcare limitations. By learning from different healthcare systems, implementing effective policies, and prioritizing prevention, we can work toward a world where diabetes is better managed and ultimately reduced. Conclusion: an ounce of prevention is worth a pound of cure. Benjamin Franklin. Throughout this book, we have explained diabetes beyond the common misconception that sugar alone is to blame. Instead, we have uncovered the multifaceted nature of diabetes, shaped by factors such as sleep, circadian rhythms, aging, stress, cultural influences, and modern lifestyles. Understanding these elements allows us to take a more proactive and personalized approach to preventing and managing diabetes effectively. Key takeaways from this book. Diabetes is more than just sugar. While excessive sugar consumption contributes to metabolic dysfunction, it is not the sole cause. Poor sleep, chronic stress, and disrupted circadian rhythms play equally significant roles. Sleep is a critical factor. Insufficient or poor quality sleep leads to insulin resistance, increased appetite, and impaired blood sugar regulation. Prioritizing rest can significantly improve metabolic health. Aging changes our metabolic responses. Diabetes risk evolves with age, making it essential to adapt lifestyle choices accordingly. Strength training, balanced nutrition, and stress management become even more vital as we grow older. Cultural perspectives provide valuable insights. Learning from different societies around the world, particularly those in the blue zones, shows that long-term health is built on holistic living, strong social connections, and a nutrient-rich diet. Stress and mental well-being cannot be ignored. Chronic stress contributes to inflammation, poor dietary choices, and metabolic imbalances. Managing stress through meditation, mindfulness, and supportive relationships is key. Science continues to evolve. Advances in diabetes research, from gut microbiome studies to precision medicine, promise a more tailored and effective approach to diabetes care in the near future. Moving forward, practical steps for a healthier life. Diabetes prevention and management require more than just medication. It calls for an integrated lifestyle shift. Consider incorporating these small but powerful changes into your daily routine. Prioritize quality sleep. Set a consistent bedtime, reduce screen time before sleep, and create a restful environment. Eat a balanced, whole food diet. Reduce processed foods, refined carbohydrates, and added sugars while increasing fiber-rich vegetables, healthy fats, and lean proteins. Engage in daily movement. Whether it's walking, strength training, or yoga, physical activity helps maintain insulin sensitivity and regulates blood sugar levels. Manage stress effectively. Incorporate relaxation techniques such as deep breathing, mindfulness, or spending time in nature to reduce stress-induced blood sugar spikes. Stay socially connected. Strong social bonds, whether with family, friends, or a community, improve mental well-being and overall health. Be proactive about your health. Regular checkups, monitoring blood sugar levels, and staying informed about new research can help you take control of your health journey. Final thought: diabetes does not have to be an inevitable part of life. By understanding the diverse factors that influence blood sugar regulation, we empower ourselves to make informed decisions that support long-term well-being. Whether through improving sleep, adjusting diet, managing stress, or adopting healthier habits, the path to better health is within reach. As science continues to unlock new insights, the most powerful tool remains knowledge applied to everyday life. The future of diabetes care is not just in medical advancements, but in the way we live each day. Let this book serve as a guide, a source of motivation, and a reminder that small changes can lead to profound transformations. Thank you for embarking on this journey. May it inspire a healthier, more balanced life ahead. Thank you for joining us on this important journey through diabetes beyond sugar. We hope the insights shared here help you take control, make informed choices, and feel more confident in managing or preventing diabetes. If this guide has helped you, please share it with someone who might need it. Together, we can help more people move beyond sugar and into a healthier, more empowered life. Stay informed, stay healthy, stay spirited with MedSpirit.